Define the key stages of a risk assessment process. Identify the hazards. Identify the people who might be harmed and how. Evaluate the risk and decide on precautions. Record the significant findings and implement them. Review and update as necessary. Explain reasons for reviewing a risk assessment. After an accident, incident. New equipment. Changes to equipment, plant, and process. Changes in personnel. Changes in legislation. Result of monitoring or audit. Action by enforcement authority. New information becomes available. Explain the criteria which must be met for an assessment to be suitable and sufficient. Identify the significant hazards and risk arising out of or connected with the work. Identify all those persons who could be at risk. Evaluate the effectiveness of current controls. Identify other protective measures required to control the risk to an acceptable level. Record the significant findings of the risk assessment. Be appropriate to the nature of the work. Define the factors that an employer should take into account when selecting individuals to assist in carrying out a risk assessment. Workers familiar with the tasks and areas to be assessed. Health and safety practitioners and occupational health nurses. Technical specialists such as mechanical and electrical engineers. Line managers responsible for the tasks or areas being assessed. Worker safety representatives, which the health and safety culture of an organization might be improved. Senior management commitment. Ownership of health and safety at every level. Effective communication and consultation. Training for all levels of employee. Shared perception of risks. Standards of acceptable behavior. Learning from experience through monitoring and review. Balance between health and safety and production. Define costs which are likely to be insured. Damage to plant, buildings and equipment. Compensation paid to workers. Medical costs. Legal costs. Define costs which are likely to be uninsured. Production delays or downtime. Loss of raw material due to accidents. Accident investigation time. Criminal fees and legal costs. Sick pay for injured workers. Overtime to make up for lost production. Hiring and training new employees. Loss of business reputation. What will determine the frequency with which health and safety inspections should be undertaken in a workplace? Statutory requirements. Activities level of risk. New equipments may require more frequent monitoring. Evaluating risk assessments. Vulnerable workers. Findings from previous inspections. Accident, incident history. Enforcement authorities' recommendation. Workers' concerns. What types of emergency that would require an organization to have an emergency procedure? Fire. Bomb threat. Spillage of a hazardous chemical. Release of a toxic gas. Outbreak of disease. Severe weather or flooding. Multiple casualty accident. What types of emergency in the workplace that may require the evacuation of the workers? Fire. Bomb threat. Spillage of hazardous chemical. Release of a toxic gas. Why it's important to develop emergency procedures in the workplace. Despite all the controls that can be introduced into an organization, things can still go wrong. Accidents and incidents do happen. When they do, it's critical that the organization has emergency procedures that can be brought into effect without delay, otherwise there may be a poor or inappropriate response that makes things worse rather than better. Define immediate and longer-term actions that should be taken. Immediate. Treatment for injured personnel. Make the area safe. Initiate emergency plan. Contact emergency services. Preserve scene for investigation. Notify enforcing authority if necessary. Longer term. Decide the depth of the investigation and select team. Gather evidence at the scene. Interview witnesses. Examine documents. Appoint specialist if necessary.
Please give comment and suggestions.
Thank you.
Subscribe our YouTube channel and hit the bell icon for more updates. Thank for visit our channel. See you next class.
Thank you.